Vancomycin by Karina, Jordan, and Sandra. Vancomycin is a mechanism of action is it is a bactericidal drug. It inhibits it's an inhibitor of cell wall synthesis and binds to the bacterial cell wall, resulting in cell death. The classification of antimicrobial drugs by susceptible organisms, it is highly resistant bacteria such as staph and narrow spectrum gram positives.
Vancomycin is administered 3 different ways, by mouth, IV infusion, and rectal dosing. The dosages for vancomycin vary, and the most common way to administer vancomycin is through an IV infusion.
So some of the side effects that we as nurses need to be aware of when we are monitoring our patients are sore throats, fever, chills, and other signs of infections. Definitely on the skin, it's going to be hives, a skin rash, and one of the most unique adverse effects or side effects to vancomycin is red man syndrome. We'll discuss on the next slide. Fainting, dizziness, blurred vision. Ototoxicity can happen where it's a ring in the ear. That's usually reversible, but it can happen. The one that we really want to look out for is nephron toxicity, which is the deterioration of the kidney function. And then also thrombophlebitis, which is the clot vein caused by pain and inflammation. So red man syndrome, as you can see here, as Jordan had mentioned before, that IV infusion is usually the most common route for vancomycin. It's a flushing of the skin, a rash, itchiness, can cause hypotension, and tachycardia. And red man syndrome usually happens when the infusion is rapid. So in order to minimize that risk, we want to infuse slowly over 60 minutes or longer. Other unique characteristics of vancomycin that we want to know is that it's safe for penicillin allergies. We want to monitor the creatine level. So those labs that come back and let us know about our kidney function. Also that the oral admin is only employed for infections of the intestine. Absorption of the GI tract is slow. And then just keep monitoring the ototoxicity. And then if we have thrombophlebitis, which happens, we can change the infusion site to reduce that effect. And this is our wrap up of vancomycin.